these are not victimless crimes. They're not just about how many records are breached. This is disruption to the availability of your medical records, number one. It's disruption to timely access to patient care, where we have delayed and degraded care with worsened outcomes. And if it happens for long enough, the financial solvency can and has driven the closure of hospitals.
Hello and welcome to the Hi-Fi Health News Podcast. I'm Erica Grotto. It's been about a year since the cyber attack on Change Healthcare that rocked the industry and affected some 190 million patients. And attacks on the industry aren't slowing down. Last year, more than 700 large breaches, that's breaches affecting more than 500 records, were reported in healthcare alone. And according to my guest today, security of records only scratches the surface of the threats we face as patients. I first spoke with cybersecurity expert Joshua Corman just after the Change Healthcare cyber attack, when it was announced the hackers had earned a $22 million payout. That payout, he told me, served as incentive for hackers to keep going after healthcare. When we reconnected recently, I asked him where things stand today.
As far as attacks on hospitals, yes, they have continued. As far as attacks on really big, systemically important entities like Change Healthcare, I think we've been a little relieved to see we haven't had as many of those, but let's color around the edges there. So without giving the entire history lesson again, I was also looking at the calendar, and it was February 5th of 2016, 9 years ago. Is that right? Yeah. Where we had the SamSam ransomware, which was not deliberately targeting hospitals, hit Hollywood Presbyterian Hospital and shut down patient care for a week. They had to divert ambulances to other facilities, and they eventually had to cancel surgeries and move critical care patients. So it was pretty harrowing with this accidental disruption. And while we had had plenty of data breaches before, and people got notification of their PHI being compromised, the disruption of patient care, that was really the opening shot in what went from an accidental compromise of SamSam. I think it was like $17,000 ransom was requested, to a deliberate business model. And healthcare has been the number one target since. So we are just taking a beating. And it went from disrupting individual hospitals to disrupting conglomerate hospitals that are chains that are across plural states, like with Common Spirit. I think it was 21 different states concurrently disrupted. And those beatings continue now. They continued before Change Healthcare, during Change Healthcare, just after you saw Ascension Health Networks hit pretty hard. So those are unlikely to disappear anytime soon because they're easy pickings, right? They're easy to compromise and they're almost certain to pay.
But the Change Healthcare attack was different, and not just because it affected so many patients. If you don't know, Change Healthcare is a firm that processes claims. They're the ones who make sure your insurance company pays your doctor or hospital for your care, or your pharmacy for your prescriptions. They're not the only company that does this, but they are responsible for about 40% of all healthcare claims. When their process gets interrupted, as it did in this case, a couple of things happen. First, a provider can't verify a patient's insurance, which could get in the way of the patient receiving care. Second, claims can't go through, which means the doctor or hospital doesn't get paid, which interrupts their cash flow, which down the line could mean they can't keep their doors open at all.
The real terrifying part, short of intervention from emergency loans from United Health Group, who owns Change, or from the federal government, is Becker's tracks that most of the small, medium, and rural hospitals have about 4 to 6 weeks of their cash flow in reserve. So if you shut off revenue cycle for more than 4 to 6 weeks, these hospitals will close. So not only is it delayed, degraded patient care, it's also a severe suffocation of their cash flow. And that can weaken them sufficient to be bought by a larger hospital and maybe strip the good doctors, the good services, the good nurses, good equipment, or similarly, the private equity takeouts that we've talked about in the past. So what you had was not one hospital having a choke to their cash flow or even one network having a choke to cash flow. You had most of the country. So Congress got pretty upset in a pretty bipartisan way. They skewered the United Health Group CEO pretty publicly twice in one day, once in the Senate with Senator Wyden leading the charge, and once in the House.
Let's talk about why things are taking so long, and particularly how hard providers are being hit, because they're paying the price for the failures that have been made on your watch. How much longer will a provider who sent in a claim for services delivered in February have to wait in order to be paid?
So that really said, okay, we have a third thing to focus on. This market consolidation can drive unsound risk concentration. And we asked the sector and HHS to finally identify these systemically important entities. So a task no one has wanted to do. No one wants to be in the scrutiny or crosshairs of regulators or Congress. But if we don't identify these systemically important entities proactively, then our adversaries will continue to reveal them to us while we burn.
At this point, we've all gotten notices about our information being included in a security breach. Sometimes we get a few in a year. To some degree, it's just a part of living in a world with modern technology. But Corman warns that trying to protect personal information is just one piece of the puzzle, and maybe not the most important one.
These are not victimless crimes. They're not just about how many records are breached. This is disruption to the availability of your medical records, number one. It's disruption to timely access to patient care, where we have delayed integrated care with worsened outcomes. And if it happens for long enough, the financial solvency can and has driven the closure of hospitals. And if there's no hospital in your zip code, or you might have to go 2 to 4 hours to get to one, you're at a much higher risk of loss of life from heart, brain, pulmonary issues, where minutes or hours are the difference between life and death. It's okay if one hospital's ransomed or shut down if there's ample alternatives within driving distance for your population needs. And as we see more of these hospitals close their doors forever, that is dramatically undermining the ability to get timely access to care, not just for a day, a week, or even a couple months, but forever. If those don't reopen, there's only two things like a community really can't survive the loss of, and one of them's a hospital. You start to see what becomes a care desert turns into a desert as people need to move away, and industry and income for the region goes down pretty quickly thereafter. So I'd like to say, why are we doing the same thing over and over, expecting different results for 20 years now, merely to protect the data that was already breached? By the time you got the ransom note, they already took the data as well.
So where does this leave the average patient? If checking your credit report a few times a year isn't enough to keep you secure, what can you actually do? You might not like the answer.
If you care more about your child's ability to get timely access to care, or your community's ability to have a hospital that's vibrant and functional, you should be advocating for these other three. Maybe at times even prioritizing that over the continued focus on healthcare data that we continue to breach. I love my privacy. I'd like to be alive to enjoy it, and our priorities are kind of whack.
And you're talking about some really big work, right?
Yeah.
This is not tips and tricks, right? This isn't one weird trick to better security. But what can individuals do to help protect themselves or to advocate from a systemic point of view? Because a lot of this work depends on other people to do it.
Yeah, I mean, we really are at the mercy of some pretty bad policy quagmires, hence the need to get vocal. So you can't directly do a ton, but let's take a simple example. When the University of Vermont Medical Center was ransomed in late 2020, as part of that big multi-hundred, multi-state disruption campaign from the Russian ransom crews to sow chaos for the U.S. election. During the pandemic, mind you, they one of the things that they studied really intently and transparently, and you can read their reports on this, is the effect it had on oncology, on chemotherapy treatment. Because if your chemotherapy recipe is locked up in your electronic medical record and you can't get it out, then you're going to not know how to continue your treatment for as long as it takes to recover that, or to start with a new oncologist and start from scratch. And when you have a loved one maybe dying, you don't want to be doing that. That's incredibly stressful and, human introduced error. Imagine a different world where you had a copy of your electronic medical record in the safe enclave of your iPhone, which you are technologically capable of doing. But right now, the P in HIPAA, which stood for portability, is not very portable to the patients themselves. It's your life. It's your healthcare. But a lot of times the healthcare networks perceive and act as if it's their data. So I think one thing we could do is, the more of us ask for and demand the ability to have copies of our electronic records and our personal use, and maybe at state level enclaves or archives, means that a ransomed hospital won't be a complete denial of access. It'll just be a shift in where we retrieve it from. Now, some of these things require recent, up to the minute, AI-driven, modifications to your record, but to at least know last known available, last good data to allow you to have the care that you need, or proof that you have a right to the care you need, we can federate and distribute this.
That's all for us today, but there's a lot more to Corman's work. His current project, Undisruptable 27, goes even deeper into the risks to our health and healthcare. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching, and we'll see you next time.